KXAN brings you in-depth coverage, growth within our communities. This is ATXpansion.
As our population grows here in Central Texas, providing quality health care to folks who live in the suburbs is becoming a bigger challenge.
Freestanding emergency clinics have become part of the solution to that issue. St. David's Healthcare here opened 2 in shopping centers recently, in Bee Cave and one in Pflugerville last year. This summer they'll open a 3rd at the site of Bastrop Community Hospital, which closed more than a year ago. They're full-service ERs that offer comprehensive care, everything from lab studies to x-rays and CAT scans too. They're usually open about 24 hours a day for outpatient care only, and people that need more help can be transferred to another hospital. The facility in Pflugerville, St. David says, saw more than 1,500 patients in the first 3 months of opening.
We narrowed the panel here just a bit to weigh in on trends like these freestanding ERs that are popping up. Chris Dammert is the Director of Navigation Services for Livestrong. We'll get a better explanation of what that means in just a moment. Dr. Russ Kreinke remains with us. He's with the Austin Regional Clinic, and Lou Little with Hardin Healthcare.
And let's go back to Brian Sanders on the floor now with a question, I think, about these freestanding clinics. Brian?
That's right, Leslie. The question from our audience is, how are freestanding emergency rooms different from regular hospitals?
Who wants to answer that?
I can give that one a...
Great. Try it.
I think it's really scope of service. Freestanding emergency rooms can pretty much deliver all of the truly emergent care that an emergency room can. However, because they're not affiliated with the hospital, if some more significant diagnostic studies are needed to perform or interventional studies, that would necessitate transfer to the hospital. So they can do the initial evaluation but not carry through all the treatment that's necessarily needed.
I know that the senior population has another issue as far as reaching them in the outlying areas as well. How are you handling that challenge?
Well, it's very difficult to reach out. I think that's one difference, especially look at hospice or something like that. It's one difference that you have with for-profit versus not-for-profit. Again, I think it's reach is so critical, and being able to provide service in these areas is critical to our communities. I do want to go back really briefly to the freestanding ERs. I really believe it's it's really innovation at work. It's a great way to meet the needs. If you look at it, to me, there's some age differences there too. It's iPhone versus BlackBerry. If you think about it, the BlackBerry folks like me have got their primary care physician, and they know that if they get sick, they're going in to see their doctor. The younger generation, so to speak, is really very happy to go to a freestanding ER. They get everything they need, they get it quick, and then they're back to what they're doing. So I think it's innovation.
I don't know what you think about that. I have a BlackBerry too.
Chris, you help folks navigate through the healthcare system. Talk a little bit about how important patient education is and some of the hurdles you encounter in getting people into the right care.
Sure. So at Livestrong, we provide a range of free navigation services, which essentially anybody that's facing the disease is going to need help navigating a very complex system. And so we provide a range of services around financial support, dealing with emotional aspects of it, dealing with fertility issues, dealing with the language of medicine. And so patient education and really understanding what somebody's going through is so important so that a patient can actually make informed decisions. And so we provide health literacy services to really help our patients be able to make decisions based on fact and be able to understand all the things that they're going through.
Now, we've touched on this issue, but baby boomers, most people now in their 50s and 60s, are expected to put a strain on medical services in the coming years. We have some numbers to show you, and by 2015, those 65 and older will make up 12% of the Texas population and 16% by 2030. So, Lou, back to you in terms of how do you handle that growth, that continuing challenge?
Well, I think there's several things. Not only are there going to be more seniors, they're going to be sicker, and it's going to take more dollars to help them. If you look at, in 2007, the amount of those people who had 4 or more chronic diseases spent by Medicare was almost $400 billion. It will be double that. It's estimated to be double that in 2017. What we need to do as a population or as a healthcare provider is we need to try to come up with innovative ways. We need to get in front of these people going to hospitals and being on the post-acute side. We need pre-acute. We need to take care of them. Managed care companies have the same thing. 5% of their population represents 50% of their spend. So there are things that we can do, but we need to experiment, and we need to figure out how, as providers, we can also get compensated for doing that.
One of our folks on social media is sending us a question tonight, how we can get more doctors to perform house calls.
That's a tough one. It really is an allocation of services. As you've heard, we're already kind of short primary care physicians, and so for a physician to do a house call is a fairly inefficient way to deliver care. Very personal, but very inefficient. I do think there are some home health care services in Austin where physician extenders, nurse practitioners, and physician assistants do deliver home health care to the house. And so I think that is one way. That's one of the innovations I think that Lou is speaking to, that there are some changes taking place to deliver care in different venues than an office setting.
We do need to look at situations where people are not just used to seeing their doctor in their home. We need to send other extenders out there, the PAs, the NPs, to provide them that comfort. There's also a lot you can do in terms of communicating as much as part of this is psychosocial. Part of it is these people feel alone. They're detached from society. So having a regular program where you reach out to them, where you touch them or talk to them on a regular basis also helps, I think that.